So you're thinking about having a DIEP reconstruction, or you've just had a DIEP reconstruction. A DIEP reconstruction is when you use your tummy to reconstruct your breast. One of the common complaints or one of the risks associated with the DIEP reconstruction is the swelling of the abdomen, and it can be very frustrating. And today we're going to be talking about why that happens and how we can help. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. So welcome to the channel, and over the next few weeks we will be talking about the risks associated with breast reconstruction and how we can help you manage this. Now today we're going to be focusing on one aspect of the reconstruction, and that is the swelling after a DIEP reconstruction. And I will try and break down why this happens. So what a DIEP reconstruction is when we use the skin and fat from your tummy along with a blood vessel to reconstruct the breast. And this blood vessel wiggles in and out of your rectus muscle. Now, although we keep the muscle, we do have to fray the muscles open to get access to those blood vessels. And then everything gets closed up, including the layer known as the aponeurosis over the muscle. This is stitched up from top to bottom, and then the skin is replaced back. Why do you get pain and why do you get the swelling? In the initial instance, the pain will be from the surgery due to the stitches, particularly in the wall of the abdomen. And that's why you may have more pain on one side compared to the other. It's likely that you had blood vessels removed from that side. This is true when you have a one-sided breast reconstruction and we only need to use one vessel. If we use two vessels, you will have pain on both sides of the abdomen, going from quite high up down to the lower part of the groin. At the same time, during the procedure, the skin is reclosed and you have stitch from going from hip to hip in the lower part of the abdomen. So where you have stitches on the inside of the abdomen and stitches on the surface of the skin, these areas will ache and sometimes sting, particularly in the first 1 to 2 weeks. So underneath the dressings, you may have some stinging sensation. Hopefully you'll be protecting your abdomen by remaining flexed at the hip, but despite this you will have more pain on one side of the abdomen and then stinging along the stitch line. The other aspect of the DIEP reconstruction which patients complain of is bloating. Now the bloating and the swelling is part and parcel of the surgical procedure, and that's due to a number of things. Number one, as the skin is lifted from the underlying tissue, the lymph system has been disrupted, which means that fluid is not being efficiently absorbed by the body, and that can cause swelling, which can last for a very long time, which is why physio and massage can help with this. The other aspect is abdominal bloating. Now, with the bloating, what patients describe with the bloating is that you will wake up with a flat tummy, and then throughout the day, it starts to swell, and by the end of the day, it does feel like a very, very tight drum, and it can be very uncomfortable and painful. And then when you go to sleep, when your body relaxes, it goes flat again. And this is the pattern that continues for some people weeks, for others it can last many months, and for a few people it can last around a year. Now, how do we treat this? Number one, for some people, it can be related to food or diet. So see if there are anything that stimulates this, but usually I advise eating small amounts of food throughout the day rather than large meals, and regular massage and physiotherapy, and this should hopefully settle things down. If you have an isolated bulge, so it's not specific, an overall distension of the belly where it feels really swollen, if it's not that and it's isolated, then that needs to be looked at specifically, where you may need to have a CT scan and make sure that you don't have a hernia, and that's another reason why someone may have a swelling or a bulge in the lower abdomen after a DIEP reconstruction. The other aspect of the abdomen which cause issues is the pulling sensation. As the nerves grow back, you can get shooting sensation in the lower abdomen, and that can cause discomfort and pain. Some days it may not happen, but as the swelling goes down and things become more apparent and the nerves try to grow back, you will get this shooting pain or shooting sensation, which hopefully should settle with time. Usually massaging the area that is shooting can desensitize the area and help soothe. And again, this can last a few weeks and even a few months after surgery. And this feeling can coincide along with the pulling. You might find if you've had a good rest and then you've suddenly done something a little bit active, it can stimulate all of these feelings such as the shooting pain sensation, as well as the bloating to be exacerbated. So when you do restart your activities, you just need to make sure that you listen to your body. If your body is starting to ache and it's hurting, that's its way of telling you need to slow down. The other reason why you will get a little bit of pulling sensation is as the muscles are healing, you have some scar development and that scar needs to relax. So again, massaging will help the scarring and it will help that pulling sensation as you continue to do more and more activities. And as you do more activities, you might find it hurts a little bit more, but then it will settle itself out. So today we talked about abdominal bloating, which can last for many months after the surgery. And it does feel like a tight drum after, and then it relaxes. We talked about the pulling sensation, and we talked about the shooting pain, as well as the general pain that you get after the surgery. I hope this information helps. And if you do have any questions, do let us know. And I will hopefully see you in the next video.